is a question that looks at a little bit of the types again of skin cancer. You talked about it, Dr. Bhatia and Dr. Young, but when we look at the A, B, C, D kind of card that we all get when we go into the dermatologist, and I'm looking at it right now, and the first word is asymmetry. So if we just talk about asymmetry of that cancerous lesion, what does that mean to the average person? How should they understand the A being asymmetry?
Well, in a nutshell, I would think that you basically can divide the lesion in half, and if one half looks different than the other half, then that's suspicious.
Do you have any comment about that?
I agree, as a matter of fact, but most of the time, if I believe that a lesion is suspicious, there is no substitute to seeing an experienced dermatologist. And I can say in my practice, though we see a lot of patients with melanoma, whenever we believe that there is the slightest amount of suspicion, I have no hesitation in making a referral to a dermatologist. So especially in patients who are at risk, either because of skin complexion, exposure to sun, previous sun damage, genetic predisposition, I think having a dermatologist actively involved in their care is very, very important. I actually believe that regular surveillance with a dermatologist will keep them away from me, because I'm usually bad news in skin cancers. So the key of all this is to figure out a way of staying away from the medical oncologist.
And I think on top of that, I'd just like to add again with the cards, the asymmetry, border, color, diameter. I think that's a great place for the average person to start, but most melanomas, we can catch them much earlier than, what these rules suggest. I think just by patients having a low threshold, and anything that's changing or feels different is bleeding, regardless of whether it's asymmetrical or has border irregularity or color variation or is larger than the size of a pencil eraser. I think those can be found much earlier if patients just use a little common sense and trust their gut.
So at today's screening, what are you looking for at the screening? I mean, besides the ABCD?
That's a loaded question. I mean, it usually takes the average dermatologist 30-some years to attain a level of experience that's going to really allow them to evaluate the skin. And it's frustrating for patients because we will often look at the skin and quickly make a decision as to that's okay, that's not okay. It just takes experience. There's really not any one answer to what are we looking for. Sometimes it's just a gut. It may be a mole that looks different than the other moles. It may be patient reports some changes in sensitivity with that mole. It's going to vary from patient to patient and from mole to mole.